Improvement Academy is based in Yorkshire and is made up of improvement scientists, patient experts and clinicians. We are committed to working with frontline teams, patients and the public to deliver real and lasting improvement. We ensure evidence-based solutions become routine practice. Over recent years, the Improvement Academy has been learning with frontline teams about the impact of safety huddles. From our early work on huddles with Leeds teaching hospitals, we have developed an innovative, non-mandatory approach to implementing huddles in the workplace. Arising from this work, the Health Foundation funded a 3-year project, Huddle Up for Safer Healthcare, or HUSH, to implement patient safety huddles in all inpatient wards in Leeds, Barnsley and Scarborough.
Safety huddles have made a big difference to our organisation. The staff in our clinical areas and our wards have taken safety huddles on board really quickly, and they've embedded them into their daily routine. I think one of the biggest successes of safety huddles is that they have involved every member of the team, so a wide range of staff. In a ward, that might mean the doctors, the nurses, the allied health professionals, but also the support workers, so the healthcare assistants and some of our housekeepers have been involved in the huddles. And in that daily huddle, everybody has a voice.
These safety huddles have become something in which the whole team is involved, from domestics to consultants and everybody in between. And that has created a great team spirit on the ward and has also improved patient safety. Patients can now be identified by whoever is involved with them as being at higher risk of falls, at higher risk of wandering, or having problems that haven't yet been identified by other members of the team. So when we do our safety huddle at the end of the ward round, everybody is involved and everybody has the opportunity to talk about the patients as they see them.
A huddle simply means a focused gathering of people. They are widely used in high reliability organisations such as the nuclear power industry and aviation, and other areas such as sport. But there is growing evidence of their role within healthcare. We have experience now in Yorkshire working with over 150 teams in different settings of adapting huddles into healthcare, focusing on safety and harms relevant to their team.
So what have we learnt are the key principles for a successful huddle? They are daily, held at a predictable time and venue. This should be appropriate to the team and context. And they should also be brief, so maximum 5 to 10 minutes. This means that they become part of routine practice.
Safety huddle is a big part of my day because I can find out which patients have got a falls risk, if they've got any nutritional problems or any VTEs that the doctors need to do. I can prompt them to do that, and I just feel that I'm a big part of the team.
Huddles should be truly multidisciplinary. This means that all the staff in the ward or area are invited to come, including non-clinical staff like ward clerks and housekeeping staff.
A safety huddle helps me daily in my role, as it helps to ensure all the multidisciplinary teams are on the same level, so we've all got the same information. It's extremely useful for the ward housekeepers as they don't get morning handover like we do. So it helps them to find out if there's any new patients, any discharges, and also if there is a dietitian at Safety Huddle, they'll also get updated of any dietary changes.
Senior clinicians, both doctors and nurses, should be involved. And it's really important that the huddle is held in a non-judgmental environment where staff are empowered to speak up if they're worried or concerned about a patient.
Well, the daily safety huddle that we have here has become really the starting point of our day. It means that the whole team come in and know that their concerns about the patients are going to be listened to. Everyone gets a chance to speak about what's worrying them that day. For me as a consultant and the other doctors on the ward, it means that we can focus and prioritise our workload to ensure that we see the most unwell patients and deal with the patient safety concerns first thing in the morning.
Since we started doing huddles a couple of years ago now, because we were one of the first to introduce them, there's been a huge reduction in falls of patients on the ward. So if I went back a few years ago, it was not unusual that we'd have someone falling almost every day. so number of falls in the dozens over the course of a month, I could never have expected the huge improvement there would have been.
The huddle should be focused on one or more patient harms and cover who is at highest risk. There should also be a set of agreed actions aimed at reducing the risk of patient harm. And lastly, the huddle should be informed by QI tools and visual feedback. This means reviewing the number of days since the last harm, bringing learning and awareness to the whole team. This should be done alongside celebrating the team's success and recognising milestones by awarding certificates. One of the most important things about the huddle is that it can be fun.
We celebrate the amount of days between falls, between pressure ulcers, and that just keeps it embedded and it keeps it fun and it keeps people engaged.
The higher the number becomes, the more competitive we all come and the higher the celebration. We've even done like Mexican waves and stuff like that.
We have shown that huddles can lead to a positive shift in ward safety culture and team working and a reduction in patient harm, with teams implementing huddles seeing statistically significant reductions in cardiac arrests, falls and pressure ulcers.
So if you and your team want to start huddling, how can you get started? Firstly, you need team engagement and a flexible approach. Start with one harm and build in more harm once huddles become more established.
It's about identifying patients that are potentially more at risk of things like falls or potential pressure areas if mobility is limited. And then as a team it gives us an opportunity to kind of clarify how we're going to prevent those risks or reduce those risks.
Use plan, do, study at cycles to test huddles, one day, one shift. And following testing, locally adapt your huddle, learning what works best for your team.
We meet twice weekly, supported by the portering management team. The huddles give porters a platform to suggest issues which are discussed and followed up.
Having access to light touch coaching helps to support and embed the principles. Lastly, access to data and use of a days between board to measure progress is essential. The huddle ignites a spirit of learning among the team. This is through making measurement visible, the team owning the data and coming together to anticipate harm and celebrate success.
I would encourage anyone wanting to improve the safety culture on their ward to get on with it. It's easy to do, it takes 10 minutes a day and it can reduce harm to your patients.
We have found that when led by frontline teams and supported throughout the organisation, huddles bring improvements in safety culture and patient harm, fun and rewards to staff, and they make what seems impossible become reality.